Hello and welcome. Today we're delving into the intricate world of endocarditis, a serious heart condition that demands our attention. We'll explore its causes, progression, symptoms, and the ways we can fight against it. Endocarditis, at its core, is an infection of the endocardium, the inner lining of your heart chambers and heart valves. The most common culprit behind this infection is bacteria. These bacteria often enter the bloodstream through everyday activities like brushing your teeth, invasive medical procedures such as dental work, or through intravenous drug use. People with pre-existing heart conditions, artificial heart valves, or implanted cardiac devices are at a significantly higher risk, as these can provide a surface for bacteria to latch onto and multiply. Let's understand how endocarditis takes hold. Bacteria or other infectious agents enter the bloodstream and travel to the heart. If the endocardium is damaged, or if there's an artificial surface present, these microbes can adhere and colonize. This colonization triggers an inflammatory response, leading to the formation of vegetations, clumps of bacteria, platelets, and other cellular debris. These vegetations can damage the heart valves, disrupt normal blood flow, and even break off, traveling to other parts of the body, and causing further complications such as stroke or organ damage. The severity of the disease depends on the virulence of the organism, the patient's immune status, and the presence of underlying heart conditions. While endocarditis isn't a common condition, it's certainly not rare, and the incidence varies with age and other risk factors. It's more prevalent in older adults, especially those with degenerative valve disease, and in individuals with a history of intravenous drug use. Patients with prosthetic heart valves or implanted cardiac devices also represent a significant risk group. Understanding the demographics and risk factors is crucial for targeted prevention and early detection efforts. The signs and symptoms of endocarditis can be subtle and develop gradually over time, or they can appear suddenly and severely. Common symptoms include fever, chills, fatigue, night sweats, and unexplained weight loss. Heart murmurs, new or changed, are a key indicator. You might also experience shortness of breath, cough, or swelling in your legs, ankles, or feet. Less common but significant signs include tiny, painless, red or purple spots under the skin of the fingers or toes, known as Osler's nodes, and painless, flat, red spots on the palms or soles, called Janeway lesions. It's vital to see a doctor if you experience any of these symptoms, particularly if you have risk factors for endocarditis. Diagnosing endocarditis requires a thorough evaluation. Your doctor will start with a physical exam, listening to your heart for murmurs and looking for other telltale signs. Blood cultures are essential to identify the specific bacteria causing the infection. An echocardiogram, either transthoracic or transesophageal, provides detailed images of the heart, allowing doctors to visualize vegetations and assess valve function. Other diagnostic tests such as an electrocardiogram, ECG, and chest X-ray may be performed to evaluate the heart's electrical activity and assess for any lung involvement. Based on all the findings, the doctor will determine the extent of the endocarditis and the best course of treatment. Endocarditis can be broadly classified based on the timing of the infection and the causative organism. Acute endocarditis develops rapidly, often caused by highly virulent bacteria like Staphylococcus aureus, leading to severe symptoms and significant valve damage. Subacute endocarditis, on the other hand, progresses more slowly, typically caused by less aggressive bacteria like Streptococcus viridans. Prosthetic valve endocarditis, as the name suggests, occurs in individuals with artificial heart valves and can be particularly challenging to treat. Identifying the type of endocarditis is important as this influences the treatment plan. The primary goal of endocarditis treatment is to eradicate the infection. This typically involves a prolonged of intravenous antibiotics, often lasting several weeks. The specific antibiotic used will depend on the bacteria identified in the blood cultures. In some cases, surgery may be necessary to repair or replace damaged heart valves, particularly if the infection is severe, the valves are significantly damaged, or if there are large vegetations that pose a risk of embolism. Careful monitoring during and after treatment is crucial to ensure the infection is cleared and to detect any complications. Preventing endocarditis is crucial, especially for individuals at high risk. This includes practicing good oral hygiene, informing your doctor and dentist about any heart conditions or prosthetic valves, and taking prophylactic antibiotics before certain dental or medical procedures, as recommended by your doctor. Avoid intravenous drug use, as this is a major risk factor for endocarditis. Education about the signs and symptoms of endocarditis is also essential for early detection and prompt treatment. The prognosis for endocarditis varies depending on factors such as the severity of the infection, the type of bacteria involved, the patient's overall health, and the timeliness of treatment. With prompt and appropriate treatment, many individuals can recover fully. However, endocarditis can lead to serious complications, including heart failure, stroke, and kidney damage. Ongoing research is focused on developing new and improved diagnostic and treatment strategies, including novel antibiotics and less invasive surgical techniques. There's also growing interest in using advanced imaging techniques to better visualize and assess vegetations. Continued research offers hope for improving the outcomes for patients with endocarditis. Always consult with your doctor for medical advice and treatment specific to your case.